500,000 women in the world die from breast cancer every year, including 40,000 from the United States. The good news is that since 1990, the rate of death from breast cancer has dropped by 2.2% every year. And some of that has to do with the excellent job we're doing as far as getting mammograms and getting screening done, and some for the better ways that we treat breast cancer. As far as mammograms, there's several different organizations that give recommendations about how often to get mammograms. They agree on some things, they disagree on others, but the big points are women between 50 and 75 should get a mammogram at least every other year, if not every year. Women under 50, between 40 and 50, if they have high enough risk for breast cancer, and there's a calculator at the end of this video that tells you how to calculate your risk. If you're at high enough risk to get a mammogram in your 40s, and this is a difference, you should get it every year. Breast cancers in women's 40s, they grow quickly. So if you're at high enough risk to get that mammogram, get it every other year. We used to tell women that they could go every other year in their 40s, but the new data shows that they need to get a mammogram every year in your 40s. And then if a woman has a high risk of breast cancer because of a primary relative, mother, daughter, sister with breast cancer, they should start getting screened at 25 or 5 to 10 years before the age of that breast cancer developing in your relative. So if your mother had breast cancer at 30, then you should start getting your mammograms done between 20 and 25. As far as exams by a doctor, studies have shown that if your doctor does an exam and you get a mammogram, there's really not any advantage over just getting the mammogram by itself. So the exam by the doctor doesn't really add anything as far as reducing your risk of dying from breast cancer. And then as far as women doing breast exams on their own, I used to tell women once a month, take the time, check your breasts. That does not appear to have any advantage. It doesn't help prevent women from dying from breast cancer. What we do recommend is that every woman get to know your breasts, get to know how they look, how they feel. If you find something new come up, then make sure and let your doctor know as soon as possible. So we have some real opportunity to help reduce the death rate from breast cancer in this country. Women, if it's time to get your mammogram, don't put it off. This is very important. That's A Minute for Health.